There's something oddly powerful about scent. A whiff of rosemary can summon memories of Sunday dinners. Lavender might instantly relax your shoulders. Peppermint makes your brain sit up and pay attention. These reactions aren't just poetic. Science is beginning to show that aromatics like essential oils may directly stimulate the brain in ways that could support memory, alertness, and even emotional well-being. Far from being the sole territory of spas and aromatherapy enthusiasts, essential oils are now being studied for their effects on cognitive function, especially via olfactory-triggered neural pathways. Unlike other senses, smell has a VIP access lane to the brain. When you inhale a scent, molecules travel straight to the olfactory bulb, which is directly wired into the limbic system, the emotional, memory, and motivation hub of the brain. That's not just close proximity. It's neurological intimacy, and it explains why smells can trigger vivid memories or sudden mood shifts with startling speed. Researchers are now digging into this sensory shortcut to see if strategic exposure to certain essential oils can actually support brain performance in measurable ways. One of the most studied in this category is rosemary essential oil, which has a long folkloric link to memory and mental clarity. Modern science is catching up to this idea. In one notable study, adults exposed to airborne rosemary essential oil performed better on memory tasks, with blood levels of 1,8-cineol, a key component of the oil, correlating to speed and accuracy on cognitive tests. Another study found that rosemary aroma not only enhanced prospective memory, the ability to remember to do things in the future, but also led to improved alertness and a subtle uplift in mood. The likely mechanism? Stimulation of cholinergic pathways, increased brainwave activity, and even slight modulation of the autonomic nervous system. Peppermint oil tells a similar story, but adds a layer of mental energy. Participants exposed to its scent often report greater wakefulness, improved attention, and faster reaction times. Some EEG studies show increased beta brainwave activity, which is associated with active thinking and focus after peppermint inhalation. This has led to speculation that peppermint could be a gentle, non-caffeinated nootropic, particularly useful for tasks requiring sustained attention. Lavender, on the other hand, plays on the opposite end of the spectrum. Instead of stimulation, it promotes calmness, reduced anxiety, and improved sleep quality, all of which can indirectly benefit cognitive health. Chronic stress and poor sleep are huge contributors to memory problems and cognitive fatigue, especially in older adults. Inhaling lavender essential oil has been shown to reduce cortisol levels and lower heart rate, suggesting an immediate downregulation of the body's stress response. In clinical settings, lavender aroma has even been associated with reduced agitation in dementia patients, making it one of the few non-pharmaceutical interventions that consistently shows promise for emotional regulation in Alzheimer's care. So how exactly do essential oils influence the brain beyond scent-induced nostalgia? One key mechanism involves neurotransmitter modulation. Many aromatic compounds like linalool, limonene, eugenol, and 1,8-cineol are believed to interact with GABA, dopamine, or acetylcholine receptors, or to modulate ion channels in neurons. Some even appear to influence inflammatory cytokines, potentially reducing low-level brain inflammation that contributes to cognitive aging. Another exciting area of research looks at olfactory stimulation as neural exercise, a kind of smell training that may help preserve or even restore memory in early cognitive impairment. Small trials have found that daily exposure to a rotating set of essential oil scents over several months improved performance on verbal memory and recognition tasks, particularly in older adults with mild memory issues. Whether this works by reactivating underused olfactory circuits or enhancing crosstalk with the hippocampus is still under investigation, but the early results are surprisingly hopeful. Still, this field is young and full of aromatic enthusiasm, but not all essential oils are created equal. Purity, dosage, delivery method, and individual sensitivity matter. Diffusing rosemary oil might feel invigorating in one setting and overpowering in another. Inhaling essential oils isn't a replacement for medical treatment, but as a complementary brain-supportive habit, it may be one of the most accessible and low-risk tools around. So, could a sniff of rosemary actually help you remember where you left your keys?
Possibly.
Could the right combination of scents help aging brains stay sharper or more emotionally balanced? The evidence is mounting. And it's a reminder that sometimes, Caring for the brain doesn't require a prescription, just a deeper breath, a well-chosen scent, and a little more faith in the powerful way your brain responds to the world through your nose.